Yeah, just the other day we had a patient who had come into clinic. She was being basically followed up because of thyroid problems. And the purpose of that visit really was to see how she'd responded to the treatment that she was getting, whether her thyroid functions had improved and whether we needed to make an adjustment in the dose of her medication. So she came along and she could tell me that she was on a tablet for her thyroid, but she didn't know how much she was taking. Now I had her blood results to hand, and the purpose of that visit was to look at the blood result and say, okay, this dose is either good for you or not good for you, and then make amendments to the dose. Now she wasn't able to tell me what she was on, and because I was able to access EMIS, I knew what dose she was on, so I could have just, I was then able to tell her, well, this is not okay for you, we need to reduce the dose down to half of what it is, and then we'll see you back in clinic. Now, in the absence of EMIS, what would have happened is I would have said to her, I'm sorry, I can't do anything for you in this appointment because I don't have enough information. So that leaves her thinking, well, I've just wasted my whole afternoon, and it leaves me thinking, well, I've done nothing for my patient. And then at the end of the clinic, I would have had to ring around to the GP surgery, which is always difficult to get through, and try and find out what dose she was on, and then give her a call at home and say, this is what your GP has told me that you are taking, this is not appropriate for you, you need to cut the dose down, and I'll follow this up with the letter so you know what we're doing. So then I have to go back, dictate another letter apart from the clinic letter, pass it on to the secretaries for typing. So it's a huge waste really of time and resources, and at the end of the day, the patient needs to have felt that something was actually being done for them, and on that particular occasion I was able to sort of provide what they were expecting. So the patient was satisfied, I was satisfied, we didn't waste any time, and so I thought that was a good outcome really. But I asked permission to review the records. They're always happy to give permission, and I try to tell them it's a new system where I can see their records from what's happened in the past and things like that, and they're always surprised to know that we've not been able to do this for so long. They think that it's something that should naturally happen, so that GPs know what we're doing and what they're doing, and everybody's in the loop, because they think that we should have some information about them, and they're just surprised that we don't, and they're always, in my experience, quite happy to let us view their records so that we can make informed decisions about their care. In the outpatient setting, you can start people on medications which they've tried in the past and not tolerated very well, or medications that they've been allergic to in the past, which you should not try at all. So yes, and making half-informed decisions can be dangerous to patient care. So yes, in the clinical setting definitely, and of course in the acute setting, the same thing applies really. So if you don't have all the information, you're not in a position to make the best decision for that patient, and that can have consequences.